Well, good afternoon, everyone. And I don't want to scare anybody who thinks no one's late, because the meetings are a little confusing. So first we're going to have Children's, Seniors, and Family Committee, and then FGOC. So if you are here for FGOC and you need coffee or chips or something, not chips, something healthy. I'm seeing Ken Yeager's face over here. Then the soonest we are going to get to FGOC is 3 o'clock. So if you're here for FGOC and you want to come back at 3:15, honestly, if we raced any sooner, well, that's just not going to happen. So anyway, if you're here for that, I'll just remind people. And I would just ask if any of you, someone sits down next to you and they look like they're here for a different meeting, please give them the nod to free themselves from one meeting that they didn't have to be at. And then on the other thing I'll just say for staff is that we've had some confusion over how to schedule these meetings, and we're going to put out another calendar. My objective was to try to put FGOC and Children's, Family, Seniors Committee, particularly for senior staff, so they weren't, I thought it would be more supportive of their calendars, and it turned out, if it ain't broke, don't fix it. So I got my lesson there. If you're here to speak on an item in front of this committee or the next committee, the yellow cards are in back. Please feel free to fill them out and give them to Frank, and we will make sure we include you. And we're just going to wait a few more minutes before we get started. But I just want to make sure if you see anybody sit next to you that's here for FGOC, give them a little push. And then if the folks who are here for Children's, Seniors, Families, if I could gather you over by our capable OBA analyst for a minute. If you're going to do presenting, I want to talk to all of you just so we can talk a little bit about time. Helpful, so there's only a few things that we want to make sure we can clarify, and if there's anything that we need to do follow-up on. The one thing I was a little mindful of is we were talking about the cancer. So good afternoon. We are going to begin our Children's, Family, Seniors Committee meeting and FGOC Committee. We're starting with Children's, Seniors, Family. We'll get to FGOC between 3 and 3:15. And so with that, we're going to just do introductions. If I could have you begin, Regina.
Regina Martin, DCSS.
Deborah Porche Usher, Social Service Agency.
Good afternoon. Rob Coelho from County Counsel's Office.
Cindy Chavez, member of the Board of Supervisors.
Dave Cortese, Board of Supervisors.
Jeff Smith, County Executive.
John Mills, County Executive's Office.
Excellent. Thank you all for being here. So we're going to go to our public comment, and this is to speak to an item that is within the purview of the committee but not on the agenda today. So welcome, Scott.
Okay, Frank. Thank you. Thank you, everybody. Scott Largent. I didn't realize we were having a meeting this afternoon. I must not be paying attention as much. Not sure if it's FGOC or children and seniors. I'll figure it out. I think you're running both today, so sometimes it can get confusing. This morning we had the Justice and Public Safety Committee meeting here, and I had talked about the civil prosecution that I'm dealing with. Now, this is what 2 criminal prosecutions turned into, and it turned into this civil one right here. So the city of San Jose filed a lawsuit, a big lawsuit, lots of discovery, lots of motions. It might not sound very interesting to any of you up there, but this is what they're doing to the homeless community. Okay, they're not running them through the criminal justice system. When they run them through civil court, you don't get an attorney. Your rights aren't protected. Okay, City Attorney Richard Doyle made a statement to San Jose Spotlight, and he talked about how it's the humane process to go. We send them through civil court. We don't have to put them through the criminal justice system. This is not civil. This is not fair. When I go in front of a judge for this lawsuit, I'm confused. I'm not an attorney. I have a learning disability. Okay? I don't know what's going on. That's why you should have an attorney. I'm not in fighting shape to be able to handle this. I shouldn't be spending all this time down at the law library trying to figure out what to do. Okay? What was the other one? Habeas corpus and writ of mandate, and there's all this Latin, okay? And should somebody really have to become their own lawyer in Santa Clara County to defend their own rights? Sylvia Perez McDonald should have assigned a civil attorney to handle this. And I have dropped this off, okay? I have provided both of you a transcript. And Dave, you're an attorney. So you should understand that I got screwed right here, Dave. You should be able to figure that out yourself. Cindy, I know you're not an attorney. Read this over and you'll be upset. But this is what we need from our leaders right here. This is grounds right here to fire Sylvia Perez. Molly O'Neill is appointed, and she ignored this stuff for years. This is how they're getting the homeless community. Okay? We talk about how we actually care about them downtown. This is it. And we need to stop the city from this bad behavior. This is unacceptable to do right here. And I dropped this off for you guys. This is the lawsuit. I don't have anything to hide. I was fighting for my property. They took my motorhome. They took everything I owned. They took my father's ashes. And these are all the people I meet in our community, in our homeless community, and what happened to them too. Thank you.
Thank you, Scott. So we're going to now go to the agenda. And we're going to begin with, to see, I don't know if there's anything we would like to put on consent. The only thing we have on consent right now are our minutes. Let me look just for a moment. Yeah, I think we're going to keep everything on the agenda. And so we'll start with item 4. This is a sexual assault process mapping. If we can have all of our presenters come forward. For most of the items today, with the exception of this, I'm asking for a 5-minute report, not to exceed 5 minutes, but I know that we're going to exceed that here. I know we have a lot of presenters. Do you know the time, Carla, of the presentation?
It's less than 10 minutes.
Okay, so about 10. Okay, great. Thank you. Just as a way of background for those of you who are here today, Dave and I put forward a referral in May on a number of gender-based violence issues, and one of them was to a referral to do an assessment of our SART process, but really what I was looking at in particular was time based on some of the feedback we got from some of our presenters. So what I'd like to do is really just thank all of the presenters, ask them to introduce themselves, and then hear the presentation. If there's anybody here from the public who would like to speak to this presentation, if you want to fill out a card now, we'll hear from the public and then hear from myself and Dave and the dais.
Good afternoon, Chair Chavez, Supervisor Cortese, David Campos, Deputy County Executive. Just go down.
Kim Walker, I'm the nurse manager for the Adult Adolescent Sexual Assault Forensic Exam Program.
Hi, I'm Lynn Tran Fong, YWCA's Crisis Intervention Manager.
Carla Collins, County's Office.
Carla, will you turn your mic on?
Oh, there we go.
There you go.
Carla Collins, Office of Gender-Based Violence Prevention.
Lieutenant Brian Anderson, San Jose Police Department, Sexual Assaults Unit.
Welcome. All right.
Great. Thank you very much, Chair Chavez. The SART Committee is a multidisciplinary team that includes the Santa Clara Valley Medical Center Adult Adolescent Sexual Assault Forensic Exam Program, the Center for Child Prevention, the Department of Pediatrics, the Office of the District Attorney, County Crime Lab, all law enforcement jurisdictions are represented as well, the Office of Gender-Based Violence. After the April 2019 hearing on sexual assault, a request was made for a process map and time study by this board to have a better understanding of what happens when a victim has a SART exam. A SART subcommittee has been working diligently to bring us this information. As you know, in September, the Office of Gender-Based Violence was created, and one of the first things we did was to engage an expert who is here, actually, in the process of mapping this effort. So with that, I'll turn it over to Carla Collins, who is going to go over the presentation. And we also have Kim Walker, who is a nurse manager from the Santa Clara Valley Medical Center, and you heard from some of these other folks. I'll turn it over to Carla.
Thank you. Thank you so much, David. Today we're proud to bring to you the first of what we intend to be ongoing reports as part of the SART Committee's function, and as we continue to deep dive into all that happens for victims of sexual assault who choose to report. So we want to quickly highlight, as David noted, that this is an incredible team that's been working together on this. What we're trying to do is assess trends, identify gaps, and work collaboratively to infuse a trauma-informed lens to the many systems that a survivor of sexual assault might navigate on their path to receiving care. We were tasked with what at first seemed like a simple question, especially because most on this team are dealing with these issues on the daily. A person reports a sexual assault in Santa Clara County, then what? But a simple question like that reveals a complex process that shows there are no fast, easy answers, and process is just, in fact, part of the story. How long does this take? Is it trauma-informed? So in order to do this particular study, we had an amazing team of hardworking subset of the SART Committee spend the last few months doing a deep dive on sexual assault cases that included a SART exam and occurred in the first half of 2019. I would also like to acknowledge that we were facilitated by a national expert on gender-based violence, Ms. Carla Dardis, and we're grateful both for her guidance and for her being here today.
She's in the audience,
yes.
By the way.
Yay. So we want to take a moment to set context for the sample size of the study. Each year in Santa Clara County, there are hundreds of sexual assaults reported, and more that are committed and never reported. Perpetrators prey on victims with no regards to their humanity, and victims of all ages, genders, and backgrounds are harmed. But in order to do the time study, we had to use a manageable sample. So the cases we reviewed only involved those where a survivor reported the assault, consented to a sexual assault medical forensic exam, which yielded a safe kit, and had a safe kit submitted and processed by the crime laboratory. The 3 paths to the SAFE exam that we included were law enforcement, rape crisis centers, and medical, and they all acknowledged that during this time period, the sample of 98 cases represents just a small fraction of all the sexual assault cases they worked on. It is, however, a worthy start to set context and allowed for the team to go far. So, our team then analyzed various points throughout the process to give a baseline information for this time study. Now I want to share more of the findings and highlights. I'm going to turn it over to Kim Walker and to Lynn, who are co-chair of our SART committee. And I'll be passing out our process map, which is so complex that it doesn't fit on a slide. But we have copies for everyone.
So just as for context for the process map, when we were looking at how we're going to best show and reflect how a patient moves through the system after disclosing sexual assault, there's so many entry points into the system that it becomes harder to be able to put that on a process map easily. So what we did in kind of considering it with the task force is to just look at the main process, which is the SART itself, the DA's office, the crime lab, the forensic examiners, the rape crisis centers, and law enforcement. And so that's what's reflected here on this map. This is a working draft. It's going to be important to remember because there are things on here that will change as we look at some of the additional workflows that aren't reflected on this. That would include emergency medical services, certainly DFS, Department of Family and Children's Services. And also, if you look up on the top of that, for those that have the paper in front of them, there is a little area that's highlighted in red. That indicates things that might delay a person coming into the system, including being taken or presenting at a non-safe facility. So if someone goes to Kaiser where we don't respond for an exam, they might have some delays getting to us so that we can do the exam. Something else to remember is that when we used this process map, we were trying to figure out how we could best represent and measure the gaps in time, the different steps that a patient goes through during the process after reporting sexual assault. It became clear that even though we wanted to measure certain segments of it, that the data wasn't necessarily available, or at least it wasn't consistently available in every case. It also showed, like for, say, law enforcement, not every agency is resourced the same, so some might have databases they can pull from, others might have manual processes. Much of the data that was being pulled did end up being a manual process for many of the people collecting just this. Knowing that we limited the sample size to 298 because we wanted to be able to look at cases that went all the way through the system, beginning to end, so we could really get an idea of where that data existed and where it didn't, so that we could improve that and then really go back and look at every case that goes through the system and measure those. We wanted to do the comparative sample, and this is what you see in this report. Some of the takeaways too with this, so reflecting areas where we might have a measurement. For instance, if you look in the report, it says, once at the hospital, a patient waits an average of 3.5 hours for an exam. That seems like a large gap, but if you look into that time segment, that's the time that the patient arrives. That would include the time that takes law enforcement to respond if they're not there on arrival. That includes the time the examiner arrives, which is, we have a 45-minute response time. Rape crisis centers have a 30-minute response time, so that's all in there. It also includes the time someone might have medical care, and they've been seen by a provider in the emergency department. So this measures the time they arrive to the time they get an exam, and all of that is in there. We need to be able to better kind of break that down, and that's where the data resourcing is going to be important going forward in our second report and subsequent reports. So that's what you can expect in those.
Yeah. Did you want to speak next? Okay.
I want to begin describing our next steps by revisiting what Kim has said, right? We restricted the study to 98 cases that had safe kits, which means it excludes cases where survivors chose to report but did not receive exams. For example, San Jose PD logged 803 cases at the same time period that we actually looked at, which is 8 times as many as what we actually used. Our study also excludes survivors who experienced assaults but chose not to report. We don't even know how to measure that number. All this is to say, the most important takeaway from this time study is not necessarily whether there are glaring gaps being highlighted in systems, but rather the level of complexity and commitment this type of project requires. The members of the SART task force who are here today worked tirelessly to produce this report, and we would like to emphasize that there is so much more to do. So throughout this process, we discovered how difficult it was to pose certain data points. Some questions we wanted to answer, but we simply couldn't, either because it would require too much manpower to hand pull the files, or we didn't have the proper measurements for them. A small example is, for example, from YWCA's standpoint, if I wanted to know the exact amount of time an advocate took to get to the hospital, I wouldn't be able to pull that number right now. We document the time we get the call and the time we leave the survivor, but not how long it actually took us to get there. We haven't had any complaints about our response time, so trying to exactly measure it isn't exactly a priority for us, but I wanted to use it as a small example of something that you might think we would readily have, but we actually don't. And there are a lot of data points that are reflected across the SART committee where that is a problem. This project has given us insight on what is and isn't possible right now in terms of data collection, and we would take these discoveries back to the full committee with the intention of broadening the scope of data collection in the future. We intend to set a data collection agenda as a full committee so that we are identifying what is useful for us to measure and then have a plan on how to do so. Something else we are also cognizant of is recognizing that we are identifying problems and barriers we observe as service providers. We are not collectively receiving any input from survivors about what they perceive as barriers. We certainly have anecdotes and we do case studies every time we meet as a committee, but there's nothing quantifiable. For example, what is an acceptable amount of time to wait at the hospital to receive a safe exam? I'm sure in an ideal world, we're all going to say right away, we want it to happen right away, but given that we don't live in that ideal world, what is actually acceptable both to us as well as to the survivors? And we don't really know this from their perspective. So it is important, and we are cognizant that we really should be identifying barriers before jumping the gun and trying to fix things that might not actually be barriers. However, I would like to emphasize that this is all a work in progress, and while we are excited and committed to continue putting in work to make our community safer, we are not experts in data analysis and research and all of the things that would require. So this is something in terms of talking about data, talking about the gaps and barriers, it's something we've been doing before we were asked to do this process map and time study, and it is something we would do regardless of any asks that come from the board. But we would like to request that if you have any specific asks or specific timelines that you want us to take on moving forward, that we would appreciate help with technical consulting, data analysis, research, all of the stuff that are really not within our immediate scope.
And next, San Jose PD, which actually had the bulk of the cases that were part of this study, will offer a few remarks.
Good afternoon. During this time period, we had 803 cases. And out of those cases that identified for the process that we were looking at from beginning all the way to a SART exam, we ended up with the 98 number, or 91 from San Jose. To start from the top, the average response time for a police officer from the time that a 911 call was put to dispatch to an officer arriving on scene was an hour and 23 minutes. When we remove some outliers, 5 hours or more response time, it was an average of an hour and 43 minutes. We do a little deeper dive into the response times. 30% of those calls took 16 minutes or less to arrive on scene. 11% took 16 to 30 minutes, and 21% took 30 to 60 minutes. So 41% of these calls took 30 minutes or less. When we look at response times, we took a look at comparing the average number of officers or sworn staff that the local surrounding police departments have, and that's part of the report. As of 12/6 of 2019, we had 927 sworn staff in San Jose. When we move on to majority, the kits or the cases that were examined during the study, 63.7% of them were as a result of rape 261 PC. The average time for a SART kit or a safe kit being booked into evidence was 13 hours and 27 minutes, which is concurrent with the fact that when an officer is dispatched to this type of investigation, from a supervisory standpoint, we assume that officer is going to be out for the rest of their shift. An average shift is 10 hours. Most safe kits were submitted within 1 day of the occurrence of the incident to the crime lab. The average time for San Jose PD to get the safe kit from our evidence to the crime lab was 1 day and 6 hours. The average time from an officer, patrol officer being dispatched to a victim of sexual assault to a detective being assigned the case was an average of 1.17 days, and that was based on a 5-day work week. Out of the 91 cases, 41 were sent to the district attorney's office. A complaint was filed on 21 of those cases. A complaint submitted to the DA. We have 2 that we're still waiting for responses on, and 18 of those cases were rejected by the DA. On average, approximately 76% of all sexual assault
Lieutenant,
cases.
could you say the last number? You said 18 were rejected? Or
Correct.
What does that mean?
They did not file
Okay.
criminal charges. On average, approximately 76% of all sexual assault cases are closed due to a lack of victim cooperation or either the victim requests to close the case. This mirrors the same trend that we have in the department in 2018, where 38% of the victims requested to close the case, and another 38 reached out and 38% could not be reached and would not respond to follow-up from the detective. And obviously, concerns that we have is the number of sexual assault victims that don't want to pursue or move forward in their cases. And obviously we have a concern with staffing and being able to respond to these in a quick and expedient manner. As far as, and that's pretty much the end of my presentation.
Thank you, Brian. And while this concludes our presentation, we believe it's just the start of the work that must continue to map out the various systems process, identify gaps in service, and infuse a trauma-informed lens into every aspect of this incredibly difficult experience for survivors of sexual assault in our county. So I'd like to again thank our incredible studies subcommittee, almost all of whom are here today, including the first few rows right over here, all available to answer any questions you might have. And I'd like to end with a beautiful African proverb: if you want to go fast, go alone. If you want to go far, go together. This work is only possible because of the dedication of an amazing team that is committed to go far together. We thank you for this time and consideration and are now open for questions.
Thank you. Let me just take a giant step back, and especially for those of you who I haven't had a chance to work with in the past. My sense about that last comment is a little directed at me because I want everything to happen fast and faster. And in part, I just want to talk a little bit about and dive deeper into the origin of the request for the report. And let me start with a bigger observation before I do that. My assumption is that everybody who is doing the work that you're doing is trying their best to work with constrained resources in desperate times, period. And that being said, I also appreciate that I presume, and I think it's actually really important for us to assume that we don't know the answers to everything, and we've got to get much better at what we're doing than what we're doing. Now, part of the reason I originally requested the study was that I got lots of feedback from victims and of sexual assault, everything from why they didn't report, the way they, some of them, the decision they made when it happened to call 911 or not, others who've waited for a very long time for counseling services from organizations that aren't fully staffed either, the Y, Community Solutions, people trying to get to their own therapists because they don't really know what to do, people reaching out to their family members. So the reason that I wanted the time study was because I thought it would give us two things. One, a better understanding of what it really takes for a victim to get through our process, report, and then get to court. I mean, if you think about this plus, it's a really overwhelming experience. But the second was, in fact, to better understand both what we don't know. We were asking questions we didn't know what we didn't know. But the other was to take a more pointed look at systems that we have in place now that are limping along and not really working. And that's actually how I feel as an outsider to the system. And part of the reason is I call different parts of you all the time to say a person just called my office and the phone number they were given from the police doesn't work. Or one of the biggest complaints I got was from somebody who'd experienced waiting in the waiting room, and the experience of being in our waiting room, like the physical experience of it, was traumatizing to the person. And so after one of our hearings, I met that person for coffee and got their feedback. Now, so that is a big, long way of saying one last thing, and this is really more to Dr. Smith than to all of you, which is that when we initially, Supervisor Cortese and I initially made the request for a time study, I frankly assumed that if you needed resources to do it, either the resources would be made available or it would have come back to the board for an action so that we could more fully fund the study. And so, and recognizing it could branch off into a bunch of different places. So I want to start with just a process question about how we proceed, Dr. Smith, because I don't want to give any more feedback without knowing that we're going to have resources attached to the research that I think you've all laid out that is necessarily, but frankly, that I thought was already going to be answered. Like I thought this meeting was going to be more of the gaps filled in because I did think we had resources for support.
Well, first of all, I want to thank the committee for asking for the process map. The old saying, if you can't measure it, you can't manage it, and you can't measure something if you can't figure out how the process occurs. And from keeping in touch with what was going on with the group, as was mentioned, the process was looked at and mapped out and found actually to be a lot more complex than any of us knew because we typically only saw our part of the whole process. So I think at this point, some of the areas that need further information have been identified. I'm sure as we go on, more will be identified. And whatever resources are needed in order to move ahead, we will move ahead. We brought in the outside expert, and if we need to bring more expertise to the table or employees, we will do that. This is, as the board is quite well aware, not a one and done kind of issue. Process mapping involves multiple tests of change, and it's never really ending. So I can assure you that we will support it and provide whatever resources are needed to get the job to continue. But like we won't be at an end point ever, but we will continue.
So here's a question. The staff has outlined a set of next steps, and we could do this one of two ways. Dave and I could do another referral that just packages it up, Or what I would hope is that if we could get frankly, you gave a really good list, but a scope of work so that they could come back and say, here's the resources that we need and here's the timeline under which we can operate. I think being able to do that is going to be really helpful, particularly I think with the Office of Gender Equities continuing to put out RFPs and RFQs, that it will help us refine the services that we're going to need to start to provide. Because one thing that I'll just point out is that among the parties, y'all complain about each other too, which I think is fine because we're trying to fix something, right? And so some of our advocates have been concerned about how long it takes for the police to be there. Some of the police have raised concerns about not being able to talk to a victim without an advocate. And so some of those kinds of some of that might be addressed. So, for example, I think with the money we're putting into the rape crisis centers, I think we're going to automatically start to buoy that part of the system. But there may be other parts that we need to examine. So do you feel comfortable with asking for a scope of work to come back to the full board, or do you want it to come here first, or how would you like to proceed?
Well, your first question, I don't think we need any more referrals because, at least from administration's perspective, we perceive this as a referral that's ongoing and we're not going to ever stop, and we'll come back and ask for resources as needed. From the perspective of scope of work, I'm expecting the team to come back to me with a suggested scope of work, and then I think we should bring it to this subcommittee. After that, I think it would be more effective if the subcommittee was the supervising group rather than the full board, just because once you get into a complex process like this, everybody goes crazy trying to figure it out, and bringing 5 or 6 people up to speed is going to be harder than the 2 of you who are already up to speed. So I would suggest that we develop the scope of work, and the team will get it to me, and we'll make sure it's prepped correctly, and then bring it back to the subcommittee, and you can see it. Or if we think that it's pretty self-explanatory, we can ask you off agenda if we should just move ahead.
What I would hope is that if we could just hear this as an information item in February and know that they have, and so the report out is, here are the resources we've applied, here are the leaders that we're bringing into the process. Because, for example, Carla, I know, have known her for a while, and I know she's an expert in this, and there are a handful of other experts that I'm sure they're going to want to reach out to. So I'm fine with us hearing who they've brought on and what the work plan looks like, and maybe we could get that at our meeting in February or March.
Sure,
Okay.
Whichever way you want to do it.
Is that okay, Dave? Yeah, oh, sure.
If I may, through the chair, our intention was, unless there was something else directed from the board, that we would look at the next steps portion of the presentation that looks at data collection, the survivor input, the additional analysis, and that we would bring a proposed plan to Dr. Smith, which then would come back to the committee as a presentation, and so I think that's in line with what you're saying.
February, March?
We'll be ready whenever you want us to be. So if you want, I think that March is probably, I'm hearing March from the folks that are on the ground. So I think we're happy to do that in March, and we will take into consideration not only extending the contract with the current expert that we hired, but also any other experts that may be needed.
And as part of that, let me just add something that I think is going to be more challenging to do, and that is really talking to survivors. And I think we're going to need lots of different ways to do that could include, different kind of information gathering. And so I think that to me, that's the most important voice. And frankly, it's the folks who aren't reporting. So it's the ones who are making a decision not to report and the folks who aren't reporting. And I as part of the team, and I apologize because there are a lot of super smart people here, but I didn't know if we had victim witness as part of the working group also.
They're part of the subcommittee. I'm sorry, they're part of the SART committee, but we're not part of the subcommittee working
I
on
think
this.
there may actually be value in having a conversation with them because folks sometimes go to them if they've been a victim, even when they haven't reported a crime. And so I think if you could just talk to Casey and maybe get a sense from Casey about what she might recommend, I'd really like to make sure that their voices are included.
So they're currently not present on the working group, but we do have data from them in the report, including what their numbers are in the last 2 years.
Yeah, I would just engage her because I think the outreach question is the one that we really need to have answered. And you know, I'm reading an awful lot of studies and reports, and I know you are too. And what's dramatic is I genuinely don't believe out of all the stuff I've read that I actually understand all the whys. And I think it's hard to have a system that doesn't respond to what people really need. And clearly, if you look at the number of sexual assaults or the reported assaults, and you take it down to, even if you didn't just look at court, but you look at one step back from court, no system works where you have that few people feeling comfortable reporting and then staying in the process. And I'm not blaming us. I'm really saying, like, let's take a fresh look and let's see what we can do. Is that under, I mean, so I guess what I'm saying there is let's talk to the smartest people we know who do that kind of work and get their thoughts on how to do it.
If I may, Supervisor, we will keep you apprised even prior to the presentation in March of our progress. The one thing about the survivor piece is that this turns out to be a lot more complicated than anyone expected. And so if, as we have those conversations, it also turns out that from their perspective, there are other things that we're not looking at, we will let you know if for some reason that impacts
Sure.
the timing of the
Yeah.
presentation.
Well, I mean, I'm going to expect, like, here's the point of the presentation. It's just a broad work plan, and I want to know two things: what the plan is and that you have the resources to do it. I don't expect the plan to be done. I think it is going to be iterative, right? But I just want to make sure you have what you need.
Thank you.
I do have just a couple questions for San Jose PD. And, you know, I appreciate the lack of staffing. I think both Dave and I were there when we didn't have that problem. And it's dramatic, and I live downtown, so I know the impact incredibly well. That all being said, I'm wondering if your work has informed our support and our staffing. And one thing I just so you know this, as part of our previous budget processes, I've been very interested in how we've had to staff different parts of the county differently, frankly, because you don't have as many officers as you need. So I know the district attorneys have more investigators. Frankly, there are a lot of San Jose cops. I'm sure you're very annoyed by that. But I'm very interested in understanding the delta of the need as you see it in terms of investigative capacity. And I know we've been working with the district attorney's office to understand that as it relates to the work we do with our criminalists. So that's another question. We are already trying to address this with the processing of the rape kits, you know, so that we're able to test them more quickly. But we also, I know, buttressed our administrative support so that we'd be able to remind officers. Frankly, this is less of a problem for you than some of the other smaller departments, and making sure we get those kits within that one-day time frame. But if there are other issues that you see that we can take a look at that don't require us necessarily to wait for new officers to arrive, because I feel like that helped. We've been looking over the horizon, and we're competing with everybody under the sun to hire good men and women for these jobs, and we're having a challenge hiring too. So do you all have ideas, or have you raised thoughts about what can be done to improve your capacity to support victims and to do these investigations?
We've started down that road. Back in May, they gave me 5 more investigators for sexual assault. And we are slotted to get another team of 5
Oh, that's
and
great.
a sergeant in investigations.
And is that to be in the next budget cycle? Or
Yeah, actually, it's already in this budget cycle.
That's
It just has to
great.
do with getting the manpower and
Hiring.
control over.
Yeah.
And in addition to that, we are bifurcating the sexual assaults unit so that we can be, there'll be a what we call a bullpen, basic investigation, sexual assaults. And then our proactive side, which is our ICAC, the Internet Crimes Against Children and Child Exploitation Detail, our Megan's Law 290, and our human trafficking will be under what we call, it's in the works, we're trying to plan it out and, excuse me, fund it. It will be under a special victims unit, which will be under 1 lieutenant. And hopefully that will be able to accelerate our proactive investigations and then also support our basic investigations for sexual assaults in the city of San Jose.
So if you see that as an opportunity to increase the number of cases, and I know we have more and more people calling us too, I would just want to make sure that we're matching what you're able to do on your end with what we need to be able to do on our end. And in particular, I do think that we're going to have to think much more critically about what's happening online, and that these activities aren't happening the same way they used to, and really being able to understand the, I've met with the team that does our computer investigations, and they're fabulous, but there's not very many of them. So something else I think we're going to have to take a look at. Thank you. Dave, did you have thoughts or comments?
Yeah, you spoke around this a little bit. The number that you talked about in terms of current SJPD sworn staffing, 927, is a current number? I know it
That
was
would
one.
be actual sworn staff that is working. So I'm subtracting
Not
those.
positions, not unfilled positions, but filled positions is what you're saying.
Filled working positions.
Right.
So subtract those that are on modified duty, on disability, or on other leaves. That's the actual working number.
Right.
As of that date.
Right. And as I recall, per Supervisor Chavez's comment, that number was 1,350 prior to, through 2008 at least. So
Right,
over
and
the-
I would compare that to authorized staffing, that number, that 1,300 number, to our current authorized staffing of 1,151.
Oh, you're saying there weren't 1,350 people available to be on the streets in 2008? Is that your contention?
That number that you brought up, I would compare it to our authorized, not actual.
But why?
Oh, I see what you're saying.
You're saying
I'm
that
just saying
wasn't
that 1,300 number that you brought up is not, it's not fair to compare it to the 927, because that 1,300 number is representative of authorized staffing. And so our current authorized staffing is 1,151.
Okay, I don't remember that number being an authorized number. When I was there in 2008, I knew it to be the number of boots on the ground, the same definition. It may have included modified duty, because we at the time considered people who were disabled but were doing modified duty and desk jobs as to being very important to the organization and actually filling positions, even though they may have not been on patrol or been able to carry a gun. But I was on the what was then called the Police and Fire
The
retirement board at the time, and I understood this to be the total amount of active pension number at that time, 1,350, not including vacant positions. But you're telling me you believe that it included vacant positions, is what I'm hearing.
You may very well be correct. I didn't come today with
I'm
numbers
pretty sure
from
I am.
2008.
I just don't want a bad record out here today or any other time. So that's why I'm trying to correct it. So you're not sure if that's okay.
And for numbers for 2008, I do not have those in front of me. So.
Okay. All right. Thank you very much. And then I just want to go back, Carla, in your presentation, there was just that kind of, if you don't mind me calling it, a snippet where you said what you need. And I just want to make sure, we have the slide in front of us, and it's in the conclusions in the packet information, and Mr. Campos already spoke to it, but anything specific, and again, not that we're going to do that today or fund anything today, but I just want to make sure if there's any more articulation to this slide that you want to mention, we need more specifically on data collection. This is really what we need. Because as I sit here, I don't know if you're talking about equipment augmentation, IT augmentation, in-house FTE augmentation, or all of the above, or none of the above. And again, I'm not looking for a final answer here, but is it those kinds of things? And can you just amplify on that a little bit?
Sure. Well, I will say to do this process, it was incredibly labor intensive. And in fact, our original sample size was, I believe, was about 117. But we had several jurisdictions that just did not have the capacity to participate. And so that's how we got down to the, further reduced to the 98. So there are serious needs around data collection and analysis in terms of the IT needs and in terms of the analysts to run that. Everyone at the table are the right people to be saying these are the questions. There was a lot of discussion and work around, how do we get to a trauma-informed space? Yeah. What are the questions we need to ask? We know these things, and we're working together on those things, but we do need the infrastructure, basically, and and certainly having the outside facilitation, I think, is what really got us over the finish line on this very intense project. So that will definitely be part of what we'll have to have in order to move this forward.
If I may, I think we're still trying to figure out all the specifics, Supervisor, but we will certainly, make sure that we are as concrete in terms of what we need.
No, I know you will be.
Come back.
I wasn't, and again, I didn't mean to probe too deeply. I was just trying to get an idea, generally speaking, which categories of support, fiscal support you would need, where that would land, either operationally or in terms of other kinds of support. But you give me enough background. I understand what you're coming back with. Thank you.
Dr. Smith, did you want to add anything else?
I just wanted to make it clear in my own mind by sort of putting out what I'm hearing from the subcommittee is we want to make sure that we have a very survivor-based process analysis, identify where we can make improvements, identify where there's measurements that are best in class, identify where we need resources and what kind of ongoing improvement we need, and we'll develop that in a part of that in the work plan, and then continue to develop it based on what we find in the work plan. Is that what I'm hearing?
Yeah, perfect.
Okay. I just want to be clear, we're all in to protect and serve our survivors, and we really want to focus on where we need to improve, and know what needs to improve. Is this number important? Is that number important? What numbers do we need to collect?
If I may, one thing that I would note through the chair is that this is not an issue that is isolated to Santa Clara. I know that, for instance, in San Francisco, there's a new district attorney who's just creating a new process to deal with sexual assaults. So the system is broken across the board, and so I think that there are a number of efforts, and we will certainly connect with some of these other jurisdictions to see what else they're doing, because it is across the board in the state.
Yeah, and I would just say, I whenever I hear someone say that, and I always feel so grateful that we're here, because we've got all of you. So I'm confident we're going to show San Francisco how to do it. Thank you all very much. We're going to receive the report. Thank you, Dr. Smith. I'm so glad you were here to hear this discussion, and we'll look forward to, by March, at getting a work plan and a time frame, and keep up all the very good hard work that you're already doing. Thank you all very much.
Actually,
and to the committee.
can I ask a question? In terms of the time frame that you're hoping to receive in March, is there any preset expectations for that time frame? Because the time frame might be a lot longer.
Yes,
then-
that I want it done in March, yes.
No,
That's
no,
my-
not the work plan, but I mean the carrying out of how long we expect it would take.
Oh, to get
gather.
all the work done?
Yeah.
No, I'm interested in hearing from you, but I will say this, that I think that one of the things that we want to make sure we're doing is that we're very iterative and that we're not waiting to the end of long processes to hail things. So for example, we could have waited to fund the sexual assault work that you all are doing, the rape crisis centers, until we finish the report, and I don't think we needed to do that to know that we had a problem. So my expectation is that we'll understand, so we have a shared set of understanding, so we have some goals, but that we're not waiting to solve problems till the end.
Okay.
Thank you. Thank you all very much. So we'll get a motion to accept the report and look forward to hearing about this in March. All right, second? That's very unanimous. Thanks, everybody. And then Frank has reminded me that I skipped item 10 or 11, our minutes, and so we'll get a motion to accept our minutes. And second. Thank you, Frank. We'll now go to item 2, and this is Social Services Agency's communications. Or I'm sorry, item 5. I apologize for that. We can have staff come up and introduce themselves. Welcome.
Good afternoon, supervisors and members of the board. Wendy Kanarash with Department of Family and Children's Services Program Manager, and as of Monday, the Assistant Director.
Congratulations.
Thank you.
Good afternoon, supervisors, members of the committee, and members of the public. My name is Don Long, and I am the Family Support Bureau Manager for DFCS. With me are also
Amber Branham, QPI Coordinator.
And Denise Marshall, Executive Director for CAFPA.
Great.
So the DFCS recognizes that the issue of communication is important, and as a department, we have been diligently working on the issue for over a year now through our Quality Parent Initiative. The QPI committee is made up of resource parents, biological parents, therapists, attorneys, court-appointed special advocates or CASAs, and of course, social workers, supervisors, and managers. The QPI have been meeting since before July 2018. The communication protocol draft was one of the protocol was one of the key priorities the QPI had worked on and culminated in the attached protocol and explanation letters. I wanted to stress that the product was a collaborative effort by all stakeholder participants. This communication protocol is to formalize and codify policies and procedures for DFCS with the goal of ensuring transparency, formalizing expectations, and increased communication between DFCS and resource parents. As an ongoing process, DFCS will work closely with CAFPA and the QPI initiative to identify ongoing opportunities for refinement, enhancements, and we are meeting to make sure that we are meeting our goals and objectives. Related to the communication channels and mechanisms, there is a slight shift with whom CAFPA will be meeting with on a monthly basis. As of December 2019, CAFPA will be now meeting with the Family Support Bureau Manager and Division Manager who can more quickly respond to program level issues. To ensure executive levels are looped in, or executive leadership are looped in, the FSB manager, myself, will ensure that minutes are captured and distributed to all participants, and including the DFCS executives, to ensure issues and action steps are identified, memorialized, and transparency to all parties. I also wanted to stress that the Resource and Advisory Stabilization Services Program has trained clinicians and will respond to crisis interventions, and resource parents have access to 24/7 consultations. The RATS team will deploy in-person support to the home as needed and operates under the understanding that, if in doubt, send someone out. As stated, the DFCS will finalize and roll out the communication protocol to ensure buy-in and adoption by all staff within DFCS to ensure increased communication with partners and resource families. And will continue to work on creating a website that provides easily accessible information to resource families. Part of that will be including creating a frequently asked questions that will be housed on the RFA website as well as the COPPA website. And with that, we're happy to take any questions from the committee.
Great. No one else wants to add anything? Denise, I've never seen you just sit there. Come on. Don't let me down.
I know, you have to be careful if you ask me to say a few words, because I often go more than that. Anyway, I appreciate DFCS working with us. I greatly appreciate the board and Cindy, you especially, for bringing this to the forefront and making sure that in the grand scheme of things, it doesn't sound like communication is a big deal, but it's a foundation for every single thing that we do for our children and every support that we get for them. Without the communication between social workers, supervisors, administration, our children are the ones that lose. So we appreciate this continuing to come up. We will be working closely. It's one of our big goals this year is to make sure that this culture changes. We've been working on it for many, many years. As you know, it usually comes up in our report every year. And in particular this year, it sounds like we have the ear at the agency and also from the board. And so we really appreciate it. And it will be one of our goals to make that change this year.
Great. I neglected to say this, but we scheduled today when Bob had a conflict. So Deborah, I apologize that I didn't say that at the beginning because I felt bad for Bob. We're doing his meeting when he can't be here, so so send my apologies to him. On this, I'm very excited about this. I think you're right. It is cultural change, but it's also got a very distinct some distinct challenges relative to process and really ingraining these communications and also recognizing that for the social workers in particular, the amount of communication they're doing with so many people, multiple families, sometimes multiple kids. And so one thing I would like to make sure that that we get is an update after this has been running a few months, both on is the protocol really being adopted? How do we know or not know? And then the other is, because I'm sure as you dive into this, you're going to see there are other strategies or things that you're going to say, oh, this may work. So for example, having a third party be able to assist with certain activities is super helpful, or it's not that helpful. And, knowing, are we creating more passages of communication versus really refining it to the people that most need the information? So those are kind of questions I'd be interested in getting back. And I'm I don't want to jump in the first quarter. I know it'll take some time, but maybe one of the last meetings of the year, we just do a check-in. And frankly, the other thing I'd be really interested, Denise, from your folks is, what are the marked differences they're seeing, or where are we not seeing differences by that time, just so we understand how deep the implementation's gone. Is that all right with everybody as a way to proceed? All right, thank you. Dave, did you have any questions on this? Great. Thanks, everyone. Keep up the good work, and I'm excited that that we're moving in this direction, so thank you.
Thank you.
Happy New Year's.
You too. All right, Can Center, my other favorite topic. Wendy's saying, no, it isn't, but it really is. There's some great work that's been done here. Welcome, everyone.
All right, so I'll let those at the table join me in presenting.
Good afternoon, Jamila Hankins, Program Manager 3 from DFCS.
And Rocio Bendis, also a DFCS Program Manager for the Safety Prevention Bureau. So I'm going to get us started with the first recommendation, which has to do with the Child Abuse and Neglect Center, CAN Center, partnering with nonprofit agencies to explore immediate and warm handoff for families in need. As you may recall, very recently I came and reported about some new prevention strategies that the department is launching. There are 3 different pathways that we're using for true prevention, and I want to just highlight that that means that these are serving families in community and not families that have come to our attention. And those 3 strategies are to work in partnership with two of our highest needs districts, Gilroy and Morgan Hill, to partner with our family resource centers and to partner internally, specifically with DEBS and IHSS, to bring families in a creative ways. To also do that, we are researching Orange County's model, which is something that has surfaced to the top, with some possibility of working with the non-report families, those families that do not require any further action. And we're researching, looking at not just the model and what they do, but the outcomes that they have developed and have they been successful as well. And then we are also working on technology. So all this goes hand in hand on how to better track our data, how to track our non-reports, what information is coming from that, and to explore trends.
So the next recommendation was to establish the county goal to achieve 100% of foster youth receiving timely medical and dental examinations. So what we did was look at LA County's process with regards to medical and dentals. They have the procedure of obtaining consent upon removal, and this has been a process that has been in place for a few years now. Within Santa Clara County, this is something that we just implemented within the past few months, so we wanted to look at their rates versus our rates. With regards to medical, LA County is at 29% as of this data is from September 2019. They were at 29% of children missing required medical examinations, and Santa Clara County was at 28%. And then with regards to the dental exams, LA County was at 41% of children missing these exams, and Santa Clara County was at 40%. So hopefully the goal is to, while we incorporate our new process of obtaining consent upon removal, to have our percentages, edge closer to achieving 100%. We also looked at the Healthier Kids Foundation with regards to their referrals for referral services for medicals and dentals. They do not work with any medical providers. However, they do provide resources with regards to dental services. They are also willing to assist us with regards to tracking and scheduling dental appointments for our youth in care. So that is a collaboration we're going to look at, hopefully within the next couple of months, within 2020. The final item, the portability of health and education passport, that document follows the youth upon placement. And then after discharge, this document is provided to the parents, the birth parents.
Great. So a couple things on the Neighbor to Neighbor program. I'm very interested in getting an actual work plan and a timeline. We've been talking about it. I know it's been a little hard getting it going, but I really want to just see us put our stake in the ground and start moving. So if we could get that in the next month, just a timeline and a work plan, and if we could get it off agenda, and if the off agenda report works, we won't, we maybe can do a one-on-one. If not, we'll have a bigger discussion about it. But I'm very, very interested in that. And one of the key issues that I want to make sure that I understand is, how we're finding families prior, like what's our big plan for finding families before they get formally into the system, and just to identify who we think those targeted families are and how we're getting to them. And then I think if we could look, and I'm also interested in who our partners are, because, I know, Wendy, you know South County so well, and as I've been having conversations with different nonprofits, there's some really interesting nonprofits emerging that are much more culturally, it's really interesting what the last few years have brought in terms of local energy and what other people are stepping up to do. So I'm really interested in who the partners are, and some of them may be our partners. They've been partners with us forever, and they're great. But there may be an opportunity for us to look for some partners that may be more culturally appropriate. On the work plan relative to dentistry, I think what, Dr. Smith, I know this is something that you've been thinking about as it relates overall to like the health centers and what we can do in St. Louis and, our issues with Foothill and other things that are making us have to take a look at dentistry in particular because they're such a big provider. But I think that the idea of working with healthier kids on the case management work is really critical. And I think that's what you were saying. You didn't use that term. And I usually think of case management as, oh my goodness, don't hire one more person to help people get to a service we don't have. But in their instance, they have evidence of their ability to work with very diverse families and actually get them to take their children to the dentist and for eyeglasses, which are really, really hard. I think much more difficult than medical. So I'm going to be really interested in us nailing down that partnership and then really being able to better understand the processes that are needed to both support, the case carrying social workers, obviously, to make it easier for them, but also to make sure that where a social worker's got their hands full with other things, this is one of those times where I feel like another set of hands is just, it's a safe place to put someone's responsibility to help them get a child their services. So I'm very interested in how we're doing on that. And then lastly, this is really for county council. I'm very interested in agendizing for one of the next couple meetings the agreements that are necessary to make this consent issue happen. And I think, if I'm right, that you all are finalizing that. I'd be really interested in us just better understanding that because I think it fits into data zone and some other things that we're thinking about that I'm really going to be interested in. And then what I'm just going to recommend from my staff is that we get a chance to spend some time with you so we can look at the passport and better understand how it works and how it doesn't work. And I think, again, some of this I know is tied to what we lawfully can share and not share. But I think being able to offer the family something that they get at the end is actually a way to entice them and encourage. Entice is probably the wrong word, but really encourage them to give us consent, because I think what they worry about is not knowing and then not knowing what to do if you don't have all the information you need. And if they see the portal as something that's is accessible to them, I think we're going to be in better shape. So I'm going to be real interested in taking a look at that, but we'll schedule time to do that. Dave, do you have anything on this? Thank you very much. This is moving in a great direction. Please thank all of your staff for the good work that they're doing, and thank all of you.
Absolutely. Thank you.
All right. So with that, we're going to move on to item 7. Wendy, you're going to stay with us a bit longer?
Just for the record, too, it might be helpful to know on the health and education passports, Jennifer and I just met this morning with child advocates, and that's one of their key areas in focus as well. So we've connected them with our public health nurse team, and they are actually going to be, we're partnering with social workers, caregivers, and kids to help bridge that as well. So
yeah,
it's
that's
gonna
another
be a
great
common
partner.
focus.
Yeah, that's a great partner, and they're really looking to do new things, so that's great. Welcome.
That's what I was thinking too. Hi, Jennifer Hubbs, Program Manager, Department of Family and Children's Services. So the out-of-home report, I try to really focus this report on things that are not covered in other reports, so it was not redundant. In listening to some of the presentations this morning, I realized I was not completely successful, but I tried to give an overview of our demographics, and you'll see that 2016, 17, and 18 showed a slight decline of the number of kids overall. This year we saw a very slight uptick, 37. I don't know if you can call that an uptick, but the overall trend of age and ethnicity stayed very stable. We also gave you the reasons for entry, which stayed the same from last year. General neglect and caretaker absence is our main issues. The reasons for exits I'm very happy to see our main reason for exit out of the system continues to be reunification with the family, with the second next reason for exit being adoption. So those are very good things. We gave you the information about the types of placements that we have, and one of the things that we want to work on is the fact that it shows that we come in with our first placements are still family-focused placements, but we tend to come in with a placement first with a foster family and then the move to a relative, and we want to focus with our family finding efforts on going first to a family, a relative or non-relative family member rather than the way that we have it. So that's going to be one of our efforts. Under service referrals, we have mental health areas, pathway to KDA, pathways to wellness, wraparound, intensive service foster care, CFT, which talks about how that we've identified CANS as our new assessment tool, and we're integrating CANS into the CFT process. That's one of our big things that we've done in the last year, and I'll talk about that in a few minutes. San Andreas Regional Center, which is our partnership with the regional center, and I'll talk about how we've increased. We went from quarterly meetings to meeting every month. Right now we have every other month we rotate showing, going to the, I don't know how to say this. So the first month we go to San Andreas, the next month San Andreas comes to DFCS. So every other month we're at each other's agency having drop-in sessions. So staff can come and talk about particular cases. We can brainstorm and answer questions for each other instead of just meeting on a quarterly basis. So that that way we can increase our partnership with San Andreas and try to deal with some of the harder to place kids more frequently. And then the education unit and the liaison, and you were saying we're really partnering with CASA now, and they're going to make that an area of priority, so that's very exciting. Next steps, family finding is huge for us. Family finding is really big. Data collection and is something that we continue to strive on. Completing the disproportionality study, like I said, the age and ethnicity continues to be at the same rate, which is, on the one hand, not such a good thing. We would like to see an improvement in our disproportionality. Expanding the CANS and CFT process. We want to work on that, and then increasing, again, continuing to increase the partnership with San Andreas Regional Center. I don't know if that was 5 minutes.
You did great. You did great. Dave, do you have any comments or questions on this one?
I guess at some point, and I don't need it right now, but I'd like to kind of make it a referral as we receive this, just a committee referral, not a referral to the Board of Supervisors. Maybe a request for information is a better way to put it, is I'd like to just get the history of the disproportionality studies that have been done by the Social Services Agency overall and DFCS over the last 10 years. Because I've been in here a number of times where we've talked about completing the work, and it's been 10 years, I believe, since the first press conference was held down in the lower conference room saying we're going to embark on this work. So I just would like, I'm just looking for a chronological history of what one-liners. I'm not looking for a 40-page report. I'm looking literally for what's the chronology of what we've stepped into, what we've tried to do, what we got back, what we stepped into again, what we tried to do, what we've gotten back, like that. Sequence.
I didn't address that in this report because the cross committee, what's the cast?
Yeah, I know what you're talking about. CAST, you mean?
The cross community
Yeah.
report that just came out a couple months ago.
Yes.
That addresses it. They did a study and it really went into disproportionality from probation and behavioral health and everything. So I didn't address it here.
Yeah, and so
I
here,
get
I
that.
think he's actually asking for something a little differently, so that
Absolutely. So
Yeah.
I know we've had multiple outside providers inside doing that, and actually the timing may be really nice. We just hired a management analyst, and one of the first tasks was to take a look at reports we have done around disproportionality. And one of the things that, although we've done a lot, I'm not sure all of those things have been very intentional and sort of followed through and linked to outcomes. So this
Right.
is perfect timing on that. So we can definitely make sure that that's
and
an
probably
off-agenda
it's just
report.
taking a slice of all of the STP. I forgot what those reports are. That we have to do every 3 years, but there's some history, but it's in a lot of places, but we can do, I think that's great. And that's a really good question for us to be looking at. The only other thing I wanted to recommend is that at a later time when you all feel like there's time to do it, I think it would be really interesting to talk about how family finding works. Just to not to demystify it a little bit, where we've placed it and what we think the result of it is. That would be great. Thank you. All right. Thank you very much, and thanks for the information. You're right. I appreciate having something fresh to look at. So thank you, and we'll and look forward to those follow-ups. So with that, we're going to move to our last item, and this is item 8, and this is our IHSS report. So we're looking forward to Wendy got to leave, and who do I get now? Oh, hi, Terry. Welcome. Thank you. My glasses were so bad. So I feel like I'm doing this today. Right. If only I was 25, 55, yeah. All right, Terry, go ahead.
Good afternoon, Supervisor City Chavez and Dave Cortese and members of the committee. I'm Terry Posley, and I'm the IHSS Program Manager. I'm here today to provide the committee with a report relating to ongoing workload issues, caseload growth, and improving service response time. The slide shows the growth IHSS has experienced since 2012 with recipients and providers. It has increased steadily at about a 3 to 6% annual growth rate. Currently, our office has over 50,000 individuals we maintain in our database, and we are responsible for answering their phone calls, responding to their voicemails, attending to their lobby visits, processing their paperwork, making any changes to their cases, correcting any timesheet errors, and conducting recipient annual face-to-face home visits. In addition to these 50,000 plus individuals, each month we receive approximately 500 new referrals from prospective IHSS recipients, and most of those referrals turn into new open cases following an intake home visit assessment. As you heard during the Public Authority's annual report on October 16th, our offices experience a recipient and provider turnover rate. During fiscal year 19, recipients had a turnover rate of 20%, and providers had a turnover rate of 28%. This means that recipients and providers are re-enrolling, causing duplicate processing work for clerical, application readiness, social worker, and supervisory staff at IHSS, as well as the public authority staff. This could be due to a variety of reasons, but a couple of examples would be that a recipient moved out of the county only to return again to open another case, or they could have Medi-Cal issues leading to case closure, which were later resolved. This next slide shows a percentage of overdue annual home visit reassessments since fiscal year 11. I received these charts from CDSS during their visit with us for their annual monitoring review. The blue line is Santa Clara. The dotted orange line represents other large counties' percentage, and the dotted gray line represents state average percentage, statewide. It shows that we had the fewest overdue reassessments during fiscal years 17 and 18. This was during the time when we hired 4 new social worker units, and we also had a brand new union contract which outlined social work home visit expectations. The state mandates that each county maintains a minimal 80% overdue face-to-face reassessment compliance rate. We peaked at 86% compliance, and we managed to maintain minimal compliance for over 3 years. Recently, however, we dipped below minimal compliance largely due to caseload growth that I discussed in the previous slide. Larger caseloads due to caseload growth do not allow the social worker to conduct annual reassessments on all their cases, which means many of their clients are not seen within the 12-month frame. IHSS has been working on a continuous quality improvement, which we call CQI, in order to improve efficiencies within the application readiness unit. This is the unit that prepares IHSS applications for social workers to conduct intake home visits. This unit consists of 6 program services aides, 2 client services technicians, 1 eligibility worker 2, and 1 eligibility work supervisor. In 2018, an arbitration decision involving the program services aides determined they were performing work duties not suitable for their classification. And as a result, those duties were immediately removed from the PSAs and assigned to their supervisor. The limitation of the program services aides classification of receiving a phone call and collecting demographic information requires IHSS to use other resources to do preliminary screening for approval or denial of benefits. Also, IHSS experienced requirement changes because of state standards, and new systems required a different skill set than we needed before. And because of these limitations of the program services aid and needs of the IHSS program, the CQI project has been identifying solutions and improvements that will decrease the wait time for an intake assessment, decrease overall phone volume, and capture relevant data to maximize efficiency. And this slide summarizes our work plan. We've already implemented some recommendations that have come out of these CQI meetings. Some of them include creating a process map, improving communication between the clerical unit and the application readiness unit, working with IT to create a simplified tool for the supervisor to assign daily incoming referrals to program services aides, filling program services aid vacancies with provisional extra help and temporary assigned staff, in addition to hiring permanent staff, paying overtime to the program services aides, and putting through a request in November for a classification study of the program services aides to determine what classification would be best suited for maximized efficiency. The classification study request could take up to a couple of years from start to finish, but it's the next necessary step to examine the appropriate classification for these job duties following the arbitration decision. We will also be focusing on the case management system of social workers completing intake and continuing home visits. The long-term IHSS goals for the CQI project would also be to meet overdue annual reassessment minimum compliance, maintain staff in proportion to growth rate, screening applicants prior to creating a new case, capturing relevant data to maximize efficiency, and implementing the CQI recommendations. This concludes my presentation today. Do you have any questions for me?
So, yes, I'm gonna just ask a couple of broad questions, and then ask Dave if there are some questions that he would like to ask, and then we'll go to the public. So first of all, I wanted to say thank you for the report. I actually thought that it's sometimes hard to bring not great news and some good news. It's, you know, to bring that forward. So I really appreciate it. I'm curious about whether or not the work plan that you have in place is actually going to address issues in a timely fashion. And let me just say why I'm asking. In 2018, when there was that dispute with the line staff about the work they were doing, one of the things that I thought was relatively unfortunate about that situation is that what it sounds to me like we did was add a step in, like another person sort of signing on or off. So the employees are doing all the same work they were doing, and then we added a step so that someone else had the responsibility of deeming it appropriate or inappropriate, where we have perfectly skilled, not perfectly, but, very skilled staff who could make that, and who were making that decision for years without complaint. But they pointed out that they were doing a bigger job that was taking more responsibility. And so I'm actually not sure if I should be asking Terry this or John, you this question, but it seems to me that the remedy, if we could do a study, and I'm sure it's, we should talk a little bit about that, but I'm not sure I would spend 2 years or even 6 months on that if the remedy is giving the employees the full responsibility, a little more pay, and then moving on so that we could fix other parts of the system that aren't working so well.
Yes, Supervisor Chavez, I don't think that the study that's contemplated is going to take as long as was quoted, a 2-year time frame. To your point, as I understand the situation, and this is kind of the problem when the arbitrator takes over and makes the decision to remove the duties from the incumbents because it's outside of the scope of their job class, that then the quick fix was to insert this other job classification that could pick up the slack and perform the pieces in terms of the assessment and referral, as I understand it. That
really the assessment,
practically, that the arbitrator deemed was beyond the scope of the program services aides. I think that we have a pretty good sense of the issues based on all of our experience through the arbitration process, that we can take a pretty quick look at the employees, their current duties, and make a recommendation in short order. And then it would just require, concurrence from the department who would be working with us on the study, and then meeting and conferring with the union.
Do you think it's possible to just honestly kind of even cut shorter there and go back and take a look at the operation as it was working to determine whether or not, because if it was working, here's really the question. If it wasn't working, I get that. But if it was working before, and really what I understand is these employees were asking to be treated the same as another level that was doing the same work, but I understand your point. The arbitrator got in and sort of, and we can't undo that. We just can't fix it ourselves. And also, if we had an arbitrator involved, that's because we fought it. Meaning we, the county, instead of just saying, yeah, okay, we see the problem. So we fought it, and then, okay, well.
Presumably. I can't speak now to sort of the specific issues that were raised in the grievance at the time, but it went through the process. I will say that.
Okay, well, that's going to be an out. I'm going to want to come back and revisit that. Just a couple of other things, and really, oh yeah, Dr. Smith?
Can I suggest we ask Rob to get that on the closed session agenda?
Oh, okay. That'd be great. Thank you.
That way we can resolve it.
Yeah, that's a really good idea. This is another question that I want to just go back to the chart of the increase in cases. If I were to look at that, you made a point about those increasing cases, that a lot of them may be people filling in paperwork inappropriately, or these are actual individual cases?
The duplicate cases that are coming back to us.
Yeah, what percentage of that would be in this program growth?
I didn't measure the percentage of this chart. Yeah, I don't have the information for you. Okay. I can get it for you.
Yeah, it'd be interesting to know that. Okay. And it kind of goes back to I didn't want to talk. What I wanted
We're just talking about where the status of the study is, and actually it's been already posted to the union, so we're waiting for the union to get back to us, so we'll give you an update in
Got it.
closed session.
Good.
Sorry.
That's perfect. No, that's not a problem. I was just going to, Dr. Smith, what I was asking is that I was asking Terry to take a look at this duplicated and unduplicated number, because the other thing that I'm just mindful of with time is that almost, people who have these services are not healthy. I'd like to get them resolved before, they're not here. So what I was interested in on this front was, whether or not we had taken a look at a really basic request in terms of increasing the number of clerical staff, at least at some level that mirrors the growth. Because what I'm nervous about is that I think the reason we've dropped so far in our ranking really has a lot to do with the fact that we have been doing a good job, frankly, more with less, and at some point, I think more just overtook less, is the way I look at this chart. So if as part of that discussion, because I get that also might be connected to the closed session issue in terms of whose responsibility what is, I would be interested in just understanding from your perspective the staffing ratio once we figure out that other issue.
I've not seen a request from the department for increased staff. I don't know, Greg, have you seen one come through? So maybe we can send that back to the department and say, put a request through if you need additional staff.
That would be great.
We'll discuss the other issue in closed session.
And then if when you bring that request through in terms of staffing, if you could give us a timeline of the last increase based on where it was in these years, because I think then the case numbers would make more sense to the people making recommendations to the board. Great. Dave, do you have questions? We have about 4 speakers.
Yeah, no, and I want to hear the speakers, plus you've covered, I think, any of the concerns or thoughts that I've had. Thank you.
All right. So we're going to invite up Beverly, Janie, Mary, and Valerie in that order, please. Welcome. Just come on up to the podium. Welcome.
Hi. Good afternoon. My name is Beverly Lozoff, and I'm a pretty new member of the IHSS Advisory Board. I'm also a longtime member of the NAMI, the National Alliance on Mental Illness Board of Directors. So as a new member, I've been learning a lot about IHSS, and I've been trying to understand, obviously, how it works. I think that Terry Posley did an excellent report to you just a little while ago. And as a representative of the IHSS Advisory Board, our recommendation is that the needs are so great and the numbers are showing that we're falling behind as a county, and we really do encourage the addition of more clerical staff so that the compliance needs can be met. And people aren't working, like in a very, very frustrating manner, because there's just too much work for the number of people assisting. Thank you.
Thank you very much.
Good afternoon. My name is Janie Whiteford. I'm a member of the Advisory Committee for In-Home Support Services. I have been since its inception. I'm very familiar with the program. I'm also involved with CICA, the California In-Home Support Services Consumer Alliance, a statewide organization of advisory committees, and we currently have 28 counties on board in that association. I'd like to speak to the increase in the number of consumers and providers in IHSS. As Terry just said, we have an annual increase of about 5%. We also have this turnover of providers and consumers, about 20%. Folks come off and they come back on. Providers go off and then they come back on. That's a tremendous amount of paperwork that has to be done. I don't think you have any idea of how much paperwork is involved in this program. The clerical staff, we have not seen an increase in clerical staff in about 10 years. The social worker staff has increased, not adequately, but it has increased, and we're very appreciative of that. But clerical staff we desperately need, because they're the ones that make everything roll. If you don't input that stuff, nothing happens. The social workers do their job. It goes to the clerical staff to be inputted and to be processed. And if it's not there, it'll sit on somebody's desk for a very long time. The problem is that this greatly impacts the consumers and the providers. The new intakes can take anywhere up to 4 months, and that is just not adequate. It's not appropriate to have folks waiting that long to get the services that they so desperately need. The providers, and I do have to say, with electronic visit verification, what's going to come into our county in the late spring, the amount of work that clerical staff is going to have to do is going to be incredible. Thank you for your time.
Thank you, Janie.
Hi, I'm Mary Tinker. I'm the Public Authority Director for In-Home Supportive Services, and I agree with everything that both of our advisory board members said. I would like to add to that, though, is that there is a huge impact whenever we don't have sufficient support staff at IHSS in being able to get the providers the information that they need to be able to get the providers into the system so that they can get paid in a timely manner. Whenever the IHSS recipient is delayed in getting into the system, then that delays the provider from being able to get paid as well. What that means in some instances is they may be working for 3 to 4 months without even being able to get paid. That also delays their ability to get health, dental, and vision benefits, because we can't authorize benefits for them if they're interested in getting them until they've actually been paid for at least 2 prior months. So it's a big snowball when there's not sufficient staffing to get the paperwork through. It's huge, and it impacts the wait time on the phones. It impacts the wait in the lobby, and the advisory board has been bringing this to the board in the annual reports for the last several years. So I thank you for your time.
Thank you very much, Mary, and to all of you who've been working on this issue. Dave, did you have any other comments?
No.
Here's what I would like to recommend. We are going to receive the report. Dr. Smith has asked for you all to put forward a budget request that, Deborah, I know this might be a little out of process or timing, but what I would like to request is if you could copy the committee on the request along with the information requested about the staffing level at the last when we started to see a significant increase, which it appears to me that would be in between 2015 and 16 is when the spike started to happen. So what the staffing level was then relative to what it is now, along with what the actual new number of total employees and the total members of the community receiving this service. The only other thing I wanted to just remind everybody here is that as we've been looking as part of Dave's work of the senior, looking at the senior committee,
senior agenda.
Yeah, I'm sorry. Thank you. The senior agenda. But the only thing I'm just mindful of is so many more of us are going to be in these categories very quickly, and us really having a handle on how to be ready for that growth is going to be pretty critical. So thank you very much.
Thank you very much.
I'm going to get a verbal report from Deborah and Regina.
Just briefly, I think Wendy made the announcement, around her appointment as the Assistant Director for the Department of Family and Children's Services. So we're very pleased to have Wendy on board with her knowledge and her skill set in bringing the teams together. Second to that, also, we've just appointed the new Director for the Department of Aging and Adult Services, and that's Marianne Warren. Marianne Warren came to us over a year ago from San Francisco in the Public Guardian's Office. More recently, she's been the Deputy Director for the Public Guardian's Office and has recently accepted this position. And so we're excited to have her on board and to move the agency forward.
Congratulations.
That's it for us.
And apologize to Bob again. Thank you.
So real quick, I just wanted to mention a couple of
important bills that impact the Department of Child Support Services. One in particular, it's AB 2684. It's regarding the parent and child relationship. It has a huge impact on, they've switched from, it's a voluntary declaration of parentage as opposed to what it was called before, a voluntary declaration of paternity. And so they've now switched that name so that it, they're basically looking out for making sure that it's taking care of those children who are conceived through assisted reproduction, to voluntarily established paternity, and also same-sex parents and transgender parents. So the change does have an impact. It goes into effect January 1st. In fact, the department has already received its first, we've had 2 mothers come in and sign a voluntary declaration of parentage. And when, some may not be aware, but when a birth parent and other parent are not married to each other, the law says the birth parent and other parent must complete a voluntary declaration of parentage to get a court order before the other parent's name can be added to the birth certificate. A lot of times understanding that is some folks don't understand that, but that is something that needs to happen. One of the other things that I wanted to mention is there is, I think, it's regarding there's a pilot program going on, or has been, or it's going to start in the courts, and it's with the court reporting. And it's, I wanted to mention this to you because I just got this while I was sitting here. The presiding judge of the family court did send an email where they recently appointed, she has to appoint a committee, and she appointed a committee, and the committee was, I believe Ignacio was appointed to the committee. The committee will be looking at the pilot program and reporting back on the remote court reporting. So that's something that they're going to undertake, and so I believe that, I don't know if it really will have an impact on us at this point, but they are going to be doing that in the family court. So I just wanted to report out. He'll be reporting back at the meetings that he has here to let you all know exactly what's happening with that committee. And that's all I think I have today.
Great. Thank you very much. Okay. Well, we are adjourned until our next meeting on Thursday, February 13th at 2. I think that's the right time. If not, you will get a notice.
We're going to reconvene as.
But Jesse, do you want to change places, or do you want to stay where you are?
Doesn't matter. We don't need to change.
Okay. Do you want to take a break, or do you want to just keep rolling?
We're going to take about 5 minutes, sort of like a recess, before we call to order the FGOC agenda, which was also noticed for today.